This is the volunteer. With that, do you agree?
Yes.
She agrees. So I'm going to start off doing the assessment on her heart. I'm going to inspect the interior. You can see. I'm going to inspect the interior chest for any hives, murmurs. I'm going to begin on the right side. Locate the Okay, and now I'm going to do the landmarks of where I'm going to be listening to her heart sounds. Okay, I'm going to get my stethoscope and listen for the diaphragm for the higher pitch, the bell for the lower pitch sounds. If there was any murmurs, you have to listen with the bell side. I'm going to start here at the aortic. The pulmonic. And the S2 is louder than the S1. Here the S1 and S2 are equal. Here the S1 is louder than the S2. S1, S2 are equal in pitch. Here's the bell side. Now I'm hearing for the lower pitch sound. Okay, I'm gonna look at the jugular venous descension. Maybe you better choose this side. Just gonna look at it. No dissension. Then I'm gonna do the corduroid arteries. I'm gonna put my 2 fingers in the neck. I'm gonna feel the pulse. Do the other side. And then I will do both together to compare, make sure they're both equal. I'm also going to use my stethoscope and listen to it with the bell side. Thank you. I'm going to now reposition a little bit and use her hand. Can I see your hand? I'm going to the arterial pulse for 30 seconds on wrist. Okay. And the other one. Oh, I'm going to do it for 30 seconds. I got 45. It's going to be 90 times 2. I'm going to get both now and compare the pulses. Just to make sure the arms are both relaxed. But I'm just trying to show you in the video the other arm. There, so you can see both. I have to compare them. The amplitude, symmetrical. They're both going to be bounding. Expected is going to be 2, which is hers is 2. They're both symmetrical in amplitude and in contour. Okay, now I'm going to do her head. I'm going to check for the blood vessels for Bruit, and I'm going to use the temporal arteries. I would have her sitting, but I want you to, well, is it possible? Can you sit up? Like this? Yeah. I'm going to get the stethoscope. And I'm going to do the temporal pulse. Can you see? Make sure that you can see. And the neck, could you hold your breath for me? Okay. We are going to do the jugular vein. You can turn away. Now the bed was supposed to be elevated to 45 degrees, but I don't have an elevation on my bed. So I'm going to look at it while I press on the epigastric area to see if there's any changes in the movement. So it's the epigastric area, if you can see my hand. Okay. Oh, sorry, I'm not supposed to touch it. I'm moving her hair because her hair is really long. You can see that's the epigastric area. Okay, good. Now we're going to lay down, and I'm going to check your abdomen for the vascularity. With the bell side, and there should be no sound present. Move your hand, move the belly button, okay? Okay. I'm going to use the bow side. Moving from the left, then I'm going to go to the right. I'm not hearing any sounds present, and I'm moving it left to right. Now I'm checking for the abdomen vascularity. Moving to the other side. So now I'm going to look at the aortic pulse. So I'm just going to press down to see if I can feel the aortic pulse. Sorry. And not just tell the patients if they're feeling any pain. Now can you sit up? I'm going to check the vascularity of the shoulders. I'm going to look at the arm, see if there's any marks on it. I'm going to look at it first, inspect it, okay? So I'm going to look at the arm and palpate to feel, if you feel any pain, let me know. All the way down to the hand, all the way down to each finger. And then the other one, I'm going to visualize it for any marks. She has no marks. If you feel any pain while I'm doing it, please let me know. Okay, I'm going to start at the shoulder, then go down. The brachial pulse. All the way down to each finger. If you feel any pain, let me know. I'm going to go down again, both sides, while checking to make sure it's equal at the same time. So at the shoulders. Then I'm going to take the arm, the radial pulse, and the brachial pulse, and then I'm going to do the lymph nodes around that area. I'm going to do the other arm. If you have any pain, let me know. No pain. Radial pulse, brachial pulse. Oh, wow, the two fingers. And then the lymph nodes in the area. Okay. Both are equal. Both are equal. +2. Bounding. Now, I could not find a volunteer with no nail polish because my sister's the only one that was with me right now for the last 3 weeks. So I'm gonna take the cap refill only for 1 second, and I'm supposed to count how many seconds for it to come back white, but I can't really check that. Well, actually, in the front, she has no nails, so I can do it from the front. Okay, checking the cap refill. 1 second, and I'll watch how many seconds for it to go back. Now I'm going to change pulses of the legs. I don't. Can you lay down all the way? The puppy. All the way. Need to do your feet. I'm going to compare the papilleta pulses. So we can compare the legs.
Want me to roll it up?
No, that's fine. Both equal. Now posterior tibial pulse. And then the front. The dorsal. Okay. And I'm going to compare toes. Inspect the nails. Okay. Now they're both equal, and brachials are equal. So I'm just gonna look over, make sure I did all the pulses. Yep, I think that was all. Okay. All right, thank you so much. That is the end of my video.